most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of
and
course,
we're serious
Bob.
about that. Today, we're going to talk about sacroiliac, low back, and pelvic girdle pain. We got 4 expert exercises to fix at home.
That's right. We've got expert Dr. Deborah Rizzo. She's written a couple books on this. Excellent information, particularly for the layperson to self-treat at home.
We also had her on our podcast, and we also had her on our channel, the interview with her.
Yep.
And we talked about a lot of these books, and she's an excellent therapist with regard to this area.
Right.
So
let's carry on.
Yeah, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section because we're giving away a masterpiece. We're giving away a Sleepovation mattress.
Right here, we got a section of
We got a sample of one here. So you can go to bobandbrad.com, go to the giveaway section, or you can go to Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And yeah, check out our podcast. You see the interview, hear the interview with Deborah on there.
Yeah, you can do it while you're driving.
So you have 700 tiny mattresses, air channels. It's cool. It's the most comfortable mattress I've ever tried, without a doubt.
You just tried it, huh?
Well, no, I've used it.
Every night, right?
Yeah.
Okay, so here we go. This is Dr. Deborah. Like I said, the podcast, you just interviewed her last week or the week before?
2 weeks ago, I think.
2 weeks ago. Yep, and she's very nice, isn't she?
Yes.
Yep. And her daughter's is the model in these books.
The model. She's a professional model.
Yep. So they've got some nice photographs, really good instructions of the exercises. We're going to go through the primary 4 exercises I'm going to demonstrate. And I believe I've got a SI problem, sacroiliac problem right now that's helping me treat. So
now let's just say, Brad, this is for women and men.
Right.
This is
the sacroiliac one is for women and men. Obviously,
this one's more for women.
But the exercises happen to be
the same.
The same, but you may, depending on your symptoms, you may do the exercises in a different series.
There's other ones she has in this one too, additional exercises.
Yeah, so if you are a woman and you have problems like postpartum or even pre, this is an excellent book for that.
It really, it's written for the layperson, so you can follow along easily, and these are fairly inexpensive.
Right.
So
they're below the video.
Links below the video.
So what should we talk about, Bob? We should show where the SI joint, the sacroiliac, so it's clear because it's a big word there, and it's kind of confusing for some. It was for me until I looked at Sam the skeleton. We got the sacrum is where the sacral comes from, the ilium, which is this bone, part of the pelvis. So sacroiliac joint.
And there's 2 of them.
2 one here and one here. It's not a joint that moves like an elbow joint. It's actually has
very little motion.
Right.
Some say there's hardly any motion.
Right.
Because there's really tough ligaments holding it together.
Right. Yep. And the musculature around here, some of the exercises are to help support it. So we got that. And this is one of those things where the pain source, we got low back. It can be hard to diagnose. Is the pain from the SI joint?
Very hard to
Is it
diagnose.
from the low back? Is it from the pelvic girdle or the pelvic floor, the muscles that are right in here between the ischials, which are part of the pelvis? So these exercises are going to address all this, and she's got a lot of years of experience, and she's really got a good system.
So one thing they call is Fortin's sign, where if you take and you can find a spot on your low back and you point like right here, and that's where it hurts. If you come right back to that spot again, that's positive. That means that you possibly do have an SI problem. That it's just really localized in really one area.
Sure. Now, with hers, I'm not going to get too detailed on her self-assessment because it would be too long of a video, I'm afraid. But it is in here. She talks about the SI joint or the ASIS.
ASIS.
Which is this bone.
This bone right here. So what basically she said, there's a lot of muscles and ligaments
right there
that tie into this.
Sure.
Tendons. Are ligaments. And if these muscles are tight on this side, that's going to make that bone tender.
Yep.
So you find that bone on you and see if it's tender. You're going to then go to the back and see if the bone back here, which is the PSIS, is tender.
Right where I'm touching here.
And you also could reach down to the pubic area here.
Yep.
And see if that's tender there. Now, if it's tender on just one side and not the other side, you're going to start with this first exercise.
Okay.
If it's not tender, if it's tender on both sides, then you can start with the second exercise.
Okay. Skip the first one?
You can skip the first one.
No.
So we're going to do just we'll show you, in case you are tender on just one side, you should do this first exercise to try to help rebalance things out.
In my situation right now, I was reading this and I thought, oh, you know, I don't have any point tenderness, a little bit back here, but I think I read in there that if you have pain in this area without much point tenderness, go ahead with the first exercise.
Sure. Yeah.
And actually, it feels good when I do it.
Sure.
So that's a good sign.
You can do it on the floor.
Yep.
Okay.
And, you know, you're not supposed to do these on a bed.
You're supposed to do a hard
Yeah,
surface.
I could do it up there, but I thought because we want to be more realistic. So you're going to lie flat. I said lie.
Lie flat.
There you go.
Yeah.
Lie flat on your back. Okay. Now you're going to always start. And I thought this was interesting with the right leg down. Okay.
Yep, exactly. We talked about that. She just said they found that's the one that works.
Yep. And actually, for me, it's my right side is where I have the pain, which she mentions there. Like this. Now, this leg comes up to here.
Yep.
With your knee bent, you're going to take this hand and push. And I'm going to push my knee towards my shoulder. I'm going to do an isometric with my hand there. And then at the same time, I'm going to lift my pelvis or my my pelvis girdle straight up off the floor so I can put my hand under there while I push. So I'm going to inhale and exhale and lift and hold as I exhale. You're squeezing that butt muscle and relax. Now, if this creates any sharp pain, you don't want to do it. Right. And on me, it feels good. It makes that area feel better. So I'm going to do it again. Now, she recommends, I believe, 10 to 15 repetitions. And if you're a person that's sedentary, you're going to be tired by the time you get done with 10 for sure. Because I get tired, or not fatigued, but I can feel it at 10.
You're working.
Yeah. So you're going to do that 10 to 15 times, and then you're going to relax. And again, make sure you breathe in, exhale while you're doing the isometric and lifting the pelvis off the floor. Okay.
Well done, Brad.
Should we go to number 2?
Sure. Number 2. Now, this is the one that you all are going to be doing if you have an SI problem and you're squeezing the knee together, right, Brad?
So
yeah, that's a good way to do it.
So, Bob, while I'm doing this, there's a ball up there, a red ball and a red loop if you want to get that. But you're going to bring your legs like this, your feet together, heels together, point your heels out, bring your knees out, and then what you're going to do is go point, as you watch my toes, they point together as my knees come together. And I'm going to hold that and go back and forth like this. Now, if you can do this easily and it's not painful, and she'd recommend, 10 up to 30 repetitions. And if you can do 30, which I can't, it's easy, I don't have any pain, then she recommends there's 2 advanced options. And what I'd like to do is, one of them, I just say this one is my number 2. I think she added that one as number 2, so I hope she doesn't get mad at me for changing the order. But just lift your hips up, and that changes the effort.
I've seen other therapists, Brad, they actually, someone put their hands between the knees. Yeah, or a fist. Yeah. And you might even feel a click when that happens. You're kind of resetting the pelvis.
But that not with this exercise.
Well, very close to what she's doing. And they do it in that same order. They do the first one kind of similar, and then they do this one next. So it's interesting. They're all trying to accomplish something, but they're all thinking it's doing different things.
Yeah.
They all work. They're doing different things in their heads.
Now, she recommended putting a pillow between the knees.
Right.
I'm going to use a ball that's squishy, and then using a loop strap. And this would be the same exercise, just a little more advanced.
Yeah, so now it's working both ways. You're going to get resistance as you squeeze.
Yeah. And I like the ball in there. She has a pillow. I don't think she'll mind with that.
I think the ball would work better, to be honest with you.
You can do it with your pelvis on the ground. Then you're going to go apart, squeeze the ball, go together, apart. If you do it with your hips up, it makes it quite a bit harder. And again, this was where I started doing them. And boy, I get fatigued. It's definitely a good workout. I'm not going to do 30 while we're doing it on the video, but that's...
And we wouldn't recommend you do 30 the first time.
No,
either. You want to start off with a lower number.
Yeah. The only reason you would, if everything feels good, it's not creating any pain, then you can, maybe you were active before the injury or whatever. Okay, now the next one, I really like this one because it feels good. For me.
Yeah.
Now, she's recommending a chair without arms. We don't have a good chair here without arms. I have to do it with a cushion on the chair because if I scoot forward past the arms, if these arms came way forward, it would not work, but these are back far enough where I can get this called the figure 4 position. And so you end up like this with
what's
good
the
posture.
which painful side?
That's a good point. I'm doing this wrong. My right side is the painful side, so I should start with the left leg up. Bob, you're going to do it there? Good.
Yeah.
Okay. And I'm going to rotate to whichever knee is up. So over here and rotate and hold.
You can even put the hand in the back like that, right?
Yep. And give a little extra pressure. You should, if it feels like a good stretch, you can go a little harder.
Really good posture on this.
Yeah.
I don't want you bent down like this and turning.
Right.
Really good posture.
And all these, think about your breathing as you hold. And now this is a 10-second hold. So it's going to be a little bit longer and then relax. You want to do it 3 times on one side as long as it's not painful. Then the painful side is the second or the last side. And I want to do this just because I want to balance out myself. It feels better, huh? Yeah, it does. And I'm going to stretch here and hold. And again, 10 seconds, 3 repetitions. I'm not going to do all 3.
Sure.
For the video, people will get, wow.
All right, we're still going. And Brad?
The last one is a easy one. It's harder than it looks, but she wants you to lay supine like this.
You were doing so well. Lie.
Oh, my goodness. Sorry. Who's our English major?
Karen.
Sorry, Karen. She recommends put one hand on your belly, one hand up here. And what we're going to do, and the verbal cue that really sticks with me, she says, pull in like you're trying to get a tight pair of jeans and zip them up. So you got to pull in everything in there, and that tightens up the pelvic floor. It tightens up the stomach, and you exhale. So the first thing you do, she says, breathe in, open up the rib cage like a umbrella, and then exhale. And as you exhale, tighten everything up, and then relax. And this is a 10 times thing. So in, get the rib cage to open, exhale, feel the stomach muscles tighten in and go down.
Get those jeans on, Brad.
Yep. Oh, zip that zipper up. And do that 10 times. And that's good for that core, that pelvic floor. And that's it. So,
yeah, that's it. And she's got some additional stretches that you can do later on as kind of a maintenance program also. And it really, she does a really good job explaining in the book. So we would, if you're having SI problems, I'd recommend putting out a few bucks for it.
Yeah, so, like did I mention Stacy was having the problems? She's going to get these books. She's anxious to read them, and give
them a try.
Yeah, it can save yourself a
So
trip
did
to
you
the
wear
therapist.
skinny jeans?
What do you mean skinny jeans? No, bell bottoms. I like bell bottoms.
Yeah, so did I.
Oh, so you mean no? I didn't wear those tight jeans, Bob.
All right, I'm just wondering.
Plain pocket from JCPenney.
Mom jeans are coming back, aren't they?
Who, Bob?
I heard high-waisted jeans are coming back.
Oh, really?
Yeah, been back.
Actually, now I've seen. My wife says nowadays anything goes. I saw a woman with bell bottoms. I saw someone with tight-legged jeans all the way down. I don't know if they had the zipper on there, but pretty much anything goes.
But everything's back so fast now. 20 years things.
Well, that's because of the internet, Bob. We got social media. It accelerates things.
Okay, I'm glad you explained that to me.
People are done watching it.
All right, thanks for watching.